Hello, I'm Dr. Fan. In this presentation, I'm going to share with you the two techniques that we can use to reduce the patient anxiety and nervousness during medical or nursing procedure. The two techniques are the talking technique and the cough and counting technique. Many patients become very anxious and nervous when they are about to have a medical procedure. The anxiety and nervousness may cause negative effects on the patient's well-being, such as elevated heart rate and elevated blood pressure. The patient may tense up and tighten up the urinary sphincter and make procedures such as placement of a Foley catheter more difficult. It is beneficial to both the patient and the healthcare provider that the patient is relaxed. Some of the traditional techniques include telling the patient to relax and asking the patient to take a few deep breaths in and out. Most patients cannot relax easily on command. They usually say it is easier said than done. Taking a few deep breaths may not calm the patient down or relax the patient either. My experience has shown that the patient may actually have a heightened sense of anxiety because he knows that something bad or something painful or uncomfortable is about to happen. The analogy is people may become more anxious and nervous when they hear the sirens that a tornado or hurricane is coming. Things to talk about. The key things to talk about are what the patient is interested in and not what we interested in. Talk about things that are positive, happy, and funny. Avoid negative things such as accidents, illness, and diseases. Examples of things to talk about are patients' hobbies like sport, fishing, hunting, cooking, gardening, travels, favorite vacation destination, where the patient grew up, and etc. Some patients may say that they do not have any hobbies and do not know anything to talk about. Then you can ask them about their jobs or their profession and ask them to teach you something that they know well. Encourage patients to keep on talking while you are preparing equipment for the procedure. If the patient asks you to talk about yourself, you can redirect the patient to talk about the patient by politely say that you had to focus on what you're doing. Let the patient do most of the talking. Just facilitate the conversation by periodically saying, "Tell me more about that." And if the subject is exciting to you, you can say, "Oh, really? It's exciting, huh?" Because the patient does most of the or all of the talking, you do not have to slow down with your procedure at all. The coughing and counting technique helps to distract the patient and relieve his discomfort and mild pain. I routinely explain to the patient that he may have some discomfort or pain during the procedure that I'm about to perform. I will explain to him that if he follows my suggestion and does the following, his discomfort or pain may be reduced. Before the procedure, I will tell him to continuously exert gentle coughs and mentally count the number of coughs at the same time. I tell the patient to cough a little louder and not to stop coughing and counting if he experiences more discomfort. Depending on the length of the procedure, I tell the patient to gently cough and count the number of coughs to about 20 or 25, like that. I had performed many procedures on the same patients, both with and without the coughing and counting technique. Those patients said that the coughing and counting technique reduced the discomfort and pain significantly. We don't know exactly how the technique works, but this technique may help distract the patient. This may be analogous to a computer. The brain functions like a computer processor. When so many applications are open at the same time, the computer processor becomes overloaded with tasks and may slow down. When so many tasks are going on, like coughing and counting, the brain may be distracted by different tasks. This may help reduce some of the perception of pain. Anatomically, coughing may also relax the pelvic floor muscles and facilitate the placement of a Foley catheter in a male patient. Coughing may also facilitate the placement of an ultrasound probe into the rectum for transrectal ultrasound-guided biopsy of the prostate. This may also be useful during insertion of a rectal tube in patients with severe diarrhea. You may find that the coughing technique useful when you draw blood, give intramuscular injection, or putting IV catheter in your patient. The talking technique may reduce some anxiety and nervousness and mild discomfort for the patient. But if the patient continues to have significant anxiety or discomfort, you can use the coughing and counting technique. Alternatively, you can use the talking technique during the preparation of the procedure, and then you can use the coughing and counting technique when you reach the part of the procedure that may cause potential significant discomfort for the patient.